to meet you. My name is Jacob.
Jacob, it's an honor. I've heard about you.
John, thanks. Pleasure.
Great to meet you, Rachel Pearson.
So we walk you around the clinic.
Oh, we'd love that.
Yeah,
Thanks.
see it. We would occasionally see patients here. It was a triage space for a while. The directors were in here for a little bit, but it was a big multi-purpose room, and it did not have these fancy windows. I love the windows. What are y'all doing in there now?
So we've used it as our chart room.
Oh yeah, all those paper charts.
We set paper charts.
They were there.
And they took up the whole wall. We got new exam tables and new wall-mounted equipment because all of the equipment used to have missing pieces. So students rushing back and forth to find blood pressure cuffs. And we have this new telehealth equipment as well. So some of our doctors during COVID, and now too, would call in and talk to patients.
Yeah.
Would you ever have imagined a room like this? When you were a student?
I mean, we had beds, but this is great. This is super sophisticated, and the equipment on the wall. And actually, the thing that's calling my attention most about this is that the room is named for David Gerson-Korn. I trained with David, and we were student directors together. Do you all still do the lab draws? Mm-hmm. Yeah, that's great. Okay, you're never gonna get that training anywhere else. You have to get that training. But at first, we were also running all the labs, and then later we started having the clinical lab science students volunteer team, and that was incredible. Mm-hmm. So they're still part of the clinic.
They are, and
that's great.
I would say, essential now because they know how to run Epic.
Oh wow!
There's all these processes and procedures for collecting the sample and sending it to UTMB.
Yeah.
I would be clueless.
Wow.
If it's not a hard copy form, I can't do it anymore.
Yeah, I feel that. Yeah, that's right. We would just do those triplicate forms, and then at the end of clinic, you would
keep them all.
You would load the labs into your car and drive them over and walk them up,
and
pass them through that window. You do.
So what happens if you get an abnormal?
If we get an abnormal, well, we actually just talked about this. So we have a new team of physicians. That's our faculty advisory board. Mm-hmm. We meet with them quarterly. And we were just talking about what we do with our labs. So the results come back through Epic, and our student team, I think like we traditionally did, will review the results, and if anything abnormal comes up, contact the ordering physician for next steps.
Yeah, but that's good to have a system for that, because that's the kind of thing where it was super easy for stuff to fall through.
Right.
Yeah.
Epic has made it a lot easier.
And then I bet having the patient's contact info in Epic is really good, because definitely there were cases where we would get an abnormal and then we're not able to get a hold of the patient because somebody had written down their phone number on a piece of paper that they had then,
or in those hard copy charts, you never go back to look at the phone number.
Yeah.
Just assume it's correct.
Exactly. Yeah. So
this is one of our medicine refrigerators, and in here we have a lot of our insulin and those are all A1C supplies, so we can do point of care A1C.
Wow, that's great.
To inform a patient, we can tell them right then to change their dose.
That's awesome.
What do you do about insulin for people that can't afford it?
It's a great question. So a lot of it is free. Our nurse practitioners primarily get this stuff, so they'll apply to the company, and they send them quite a bit, actually. So that's for that small supply. We have some here labeled for specific patients, and those are from the pharmaceutical programs, the PAPs. So that's another option. And then the HOPE board, which is the nonprofit board for the nurse managed clinic, purchases a bunch of insulin as well. Mm-hmm. So there are a lot of sources. We try to piece it together to make sure patients get what they need.
And are you generally able to get insulin-dependent patients insulin, or?
Yes.
Yeah.
So.
Yeah,
it
that's great.
Oftentimes takes adjustments because we can't always match exactly what they left the hospital with.
Sure.
But we get as close as we can.
In terms of the brand or
In worst case scenario, right? I mean, now Walmart, you can do it without a prescription, so we can at least make ends meet in that way for people who need a little more convenience and are able to afford the small fee for the monthly bit of insulin.
Mm-hmm. Wow.
And our team in the hospital, the UTMB doctors, we're trying to communicate with them better. They, I think, are already aware of the cheaper insulin for patients without insurance, and so they try to send them home on those. But I think those at Walmart, the ones without a prescription, may cost about $25 per vial. So it's not out of reach for most. Mm-hmm. It's still an expense, but it's not like hundreds of dollars a vial.
Yeah. And are y'all seeing kids at all, or still just adults?
Teen Health is similar to St. Vincent's, except it's for children, and it is a bunch of clinics embedded in schools.
Oh,
local
that's
schools.
right. That was starting up when I was here. That's Jeff Temple and his team. Yeah.
So they got
great.
funding from Sealy and Smith a few years back to get started, and we felt that they were more equipped.
Sure.
They even are open during the summers, despite being in schools. So
I mean, that's great. You know, if somebody else is meeting that need, then no need to
right,
duplicate efforts.
absolutely. Great. So
This is awesome.
this was starting right when you were leaving.
That's right. Yes. And so what all do they do? Cleanings, extractions?
Early extractions.
Yep.
The cleaning, to get a dentist to do a cleaning, we're probably not leveraging them in the best way.
Sure.
And it's been tough to get a hygienist.
Yeah.
Just figuring out how to do that.
Man, one of the patients that just broke my heart when I was a student was this woman who had horribly painful teeth. So much pain, such bad teeth, and this is gonna sound cheesy, but there's this Raphael Campo poem, What the Body Told, and there's a line in it that says, I looked into another person's mouth and see the desolation of the world. I always thought about that when I was caring for her, and we could not get her in with a dentist. We tried and tried, and it was awful to see her go through that. And the fact that y'all are able to do that care here now is just incredible. It's really great to see.
We're very grateful. We really want to expand. As you can imagine, the need is tremendous.
Yes.
We can only see, I would say on average, about 4 to 6 patients per Saturday. And that is not nearly enough.
Yeah,
So we're hoping to add more chairs downstairs and expand.
that's great. That's great. And, push for that policy change that gets dental coverage under, usual healthcare coverage. But the banana room.
John, do you have a key?
I do.
Maybe they still do. An apple a day keeps the doctor away.
Yeah.
Somebody here said a banana a day instead. And so that's
They
stuck.
painted
and
it.
Someone painted a banana. And
Well,
I think actually it says a banana a day.
It always felt fitting that this was the room full of the student directors. It was the banana room. Because it was bananas. Wow. Oh my gosh, ophthalmology.
Yes.
Ophthalmology is happening. Look at all these machines. Do you use all these?
They do.
Wow.
So ophthalmology comes in once a week on Monday afternoon. They're here for the whole afternoon into the evening. They will use this room for that chair that's stationary, but all the rest of this equipment they roll out into the exam rooms and they will do their clinic.
Wow. And so you get your diabetics their retinopathy screening, that kind of thing? Yeah.
And they do, what do they do?
Tell them about the screening with the Zeiss gun.
Oh yeah, you can.
Tell me.
Sure. So, something that I'm really excited about, because it's as amazing as it is having a team of ophthalmologists come in once a week. We have patients here 6 days a week, right? And there's only so much you can do. We have to be really protective of opto's time because they only have so many slots. So one thing we've been able to do is we were able to get a donation for something called a Zeiss Visu Scout, which basically is like the fundoscope that none of us can really use.
Yeah, because
and
it's
instead
impossible to see the retina if the eye's not dilated.
It's impossible.
Everyone,
No
one
unless you're
tells
Dr.
medical
Beach.
students that.
Yeah, unless you were Dr. Beach, I don't think anybody is really capable. He'll tell me,
Dr. Beach, of
do you
course,
see the
can.
venous pulsations? I say, Dr. Beach, I sure don't, but I'm so glad you do. And, the Zeiss gun is pretty amazing in that it kind of decentralizes things. So now you don't have to be an expert with a fundoscope. You can just take with a camera a high-def picture of somebody's retina. We send it over to ophthalmology, and they tell us disease or no disease.
Wow.
And they're able to come in and put them on the schedule. So that's been amazing, and that's really, to me, that's kind of the new wave of St. Vincent's, right? Is doing more with less and making sure that we use either technology or new ways of thinking or new systems to try to get as many people the care that they need that we can.
That's awesome.
Rachel, what specialties were here when you were a student?
So, psychiatry, gynecology, dermatology, and neurology. There was neuro. I think that's it. And then we would call in subspecialists as needed. So we had a rheumatologist who would come when we needed them. Dr. Beach was our nephrologist, of course. Yeah, I mean, gosh, we had pathologists who came in to review biopsies, and of course, otolaryngology with Dr. McCammon. Yeah, but the regular ones were, yeah, gen, psych, general primary care, neurology, dermatology. Dermatology was so important. You know, I didn't understand how common skin cancer is among folks experiencing homelessness and folks living in poverty, but yeah, that dermatology was really critical. And what all do y'all have now?
All of those and some more, and maybe a little bit more scheduled than as needed. So,
Yeah.
ENT, endocrinology,
That's great,
rheumatology are all
endo.
scheduled like
Wow.
once a month.
Urology now as well. The official tally that I won't bore you with is when we condense it down into the overarching things, it's about 20 different clinics that we have available in terms of it's getting epic because now we're all on one medical record and we can at least talk to one another about the same patient and be working from the same record. So we have 6 days a week clinic when we consider all of those combined clinics together.
I see. And then how often is the student-run clinic?
Probably similar to what you know.
Tuesdays, Thursdays, and
evening,
Saturdays?
Saturday.
Okay.
And then our new interprofessional clinic, which we spoke briefly about being part of the curriculum. So that's on Wednesday afternoon.
I see. Wow.
The reality is that the price that you pay as a leader, both in moral distress and just seeing so much suffering around you every day, and in the missed opportunities to be with family, the missed opportunities to take care of yourself, for the sake of people who just don't have anywhere else to go.
Yeah.
It's where you learn to love at UTMB, right? It's a totally different feel than anything else you'll experience.
Yeah. That's really beautifully put.
But you know, kind of like I was telling you with the ophthalmology
Just
clinic,
echoed yourself.
Yeah. Well, you know, the amazing thing about a lot of the different tech pieces and artificial intelligence innovations that are out there is that you can revolutionize free clinic medicine, right? We've always had to do more with less, and now we're able to do more with more, thanks to a lot of really generous donations, right? But the beautiful thing about this is having this in the clinic. We've been able to use this for a lot of our patients with heart failure, a lot of our patients with, horrible back pain, with bloody urine, and you're worried about a kidney stone. And
Yeah.
where historically, because we were working with incomplete information, probably would have just had to send them to the hospital. And we know how close everybody is to bankruptcy with
Right.
a decision like that. It can't be taken lightly. But with this, I can take this picture, I can send it to a cardiologist, and they can look at it from their office and just tell me, this is what I'm seeing. And we're just that much more comfortable with what we can do here. So it's expanded not only the quality of the care for the patients, but also our ability to make cost-effective decisions with them to try to help them figure out what risk am I really running right now and how do I deal with it.
That is awesome. I love that you can get those images transmitted. That was a huge, imaging was a huge stumbling block for so many of our patients. Not, there was like diagnostic imaging for acute concerns, but also like our hepatitis C patients who needed scheduled ultrasounds, all that kind of routine imaging as well. We would send them to a private imaging facility where they could get it at the cheapest market rate. But many of the times they couldn't afford that. And so when we really had to, we would patch together funding, but being able to do that imaging yourself is great. And it's such a harm-free technology. I mean, we use it in pediatrics all the time because there's no radiation.
Absolutely.
John uses it primarily, so he started a heart failure program, and he uses it primarily for that. And with the AI that she was talking about, if he lines it up in the right way, it will get to measurements that are
Just what you need.
usable for the
That's
cardiologist.
great.
That's so cool. Yeah.
So great to
course.
meet you. Thank you so much for
pleasure
showing
and
me
honor.
around. It's
Yeah,
like
thanks
really
for coming
great
back.
to
Absolutely.
be here. It's such a special thing.